Data, AI, and innovation in healthcare is a very important question, especially in a pandemic. And I'm looking forward to a very international panel discussion with Alexander Thamm, David Ruau, and Abel Archundia. And I think Alex has the first question for those guys.
Thanks, Daniel. So we heard a lot about data and innovation in several areas, especially in the medical health industries within the last talks so far. And what I would like to know, Alexander, could you tell us a bit more about, do we already have enough data and do we even get them quick enough?
Yeah, so hi everyone, and glad to hear you now. Very good. Depends, right? I mean, I think for most of the applications we talked about, there is already a lot of possibility, and there's already also some great examples where AI is actually saving lives and actually really put into usage and into practice. But especially in terms of the distribution of medical data, the data privacy concerns, obviously, and also the usage. As we talked about, for example, for fighting the pandemic, I think there's still a lot of place to grow and room for improvement.
Something you said, which is, let's call it controversial. Do we have enough data? Well, the studio fixes for the next questions. Let's address that question in particular. My role over the last 5, 6, 7 years has been to work with practitioners of data science, people that had in mind pilots that I already had a business problem that they were trying to solve with data science. For the last few years in particular, and working with people like David and David himself, we were looking at solving problems around discovering new drugs or finding a better fit between the drugs we have and the patients we have. And that is basically the two big things about precision medicine: being faster in finding good drugs and being faster in finding the right patient for those drugs. I paid a lot of money over the last 5 to 6 years trying to find data of sufficient quality and sufficient detail, so high-grade data, particularly in Europe. So I'm going to basically, from a European perspective, I think that we do not have sufficient quality data to be able to advance the case of precision medicine. This is not the case in the United States or in China, to name two big data producers. Both China and the United States have populations in total more or less the same size of, let's say, data generators, to use a very crude term. They generate more or less the same volume of data, but the European data is terribly fragmented. So you need in Europe to have a phase zero, a step prior to actually doing precision medicine, where you are assembling data, that you can have sufficient data with a sufficient quality to launch data science exercises. So this is my perspective, as you will hear in the next few minutes, is mostly financial and business-wise. So as an investor, you spend a lot of time and quite a bit of money in creating the data sets even before the Ferrari of data science starts working. So that just extends forward the time of the return of investment and stretches the patience of the sponsor, the champion of data science experiments in the precision medicine field. That is terribly frustrating for me as an executive, as an investor. And I will hand over to David to maybe disagree with me, hopefully, from the perspective of the practitioner.
Yeah, thank you, Abel. And I mean, I'm good. It's really good to be here. The conversation is starting really well already. It's you made an analysis, Abel, of the fragmented healthcare landscape in Europe and comparing it to China. I mean, it's and comparing it to the US, where they finally implemented, in fact, over there into, I would say, a forward-thinking way, the FHIR interface on top of the healthcare data, which is a fast interoperability network resource. I mean, it's a game-changing technology. So they implemented in their law that all the data from patient need to be interoperable, and the patient is allowed legally to request their data into a digital format, and is allowed to use any app to do that. It's creating, if you want, a network, a mesh on which the data become more fluid and liquid and can move around and create, in fact, opportunity for, I mean, investors, company to build and add solution on top. Researchers, yes, of course, use this data, but we need to think also of the network, the economic network that goes around. And that, I think, is a big difference. I mean, the pain it is to gather the data in Europe, to have a cross-country data set is humongous. So I'm working into a company called Sensyne Health, where we are UK and US based, and it's extremely hard to penetrate the market in France and in Germany. It's a real challenge. The law should be the same, but they are not. And you have the barrier language also. It's coming on top because the records of the healthcare system are in French, in German, in Swedish, in all the language. And that's, I mean, it's a fantastic area for data scientists which are doing natural language processing, yes. But to move the science forward, it's a real challenge. Yeah.
So I hope you can hear us now again.
Yeah.
Sorry for those technical problems. Maybe one thing about what you already mentioned, Alex, we see a lot of fraction of how we collect data, especially now during this pandemic all over Germany. So basically every part of Germany is doing it differently. We do know that, for example, Bremen is pretty good at collecting more or less real-time data when it comes to COVID cases. So we at least have like pretty good database up there. But in Munich, for example, I already mentioned it earlier, we have like a delay of 4 or 5, maybe even 5 days until we can really rely on the data we have. So what Abel already mentioned, that the data is very fractioned around Europe. We already have that problem in Germany, right? Maybe Alex, you can give us some information on that.
Yeah, I think it's what we mentioned before, that the data itself, it's not the quality of the data, let's say, is not the real problem, but the gathering of the data and the joining and the speed of the information even leads to a necessity of what we call nowcasting, what we explained in the talk before. And I think it's still interesting that, let's say, in the 5th or 6th wave, I don't know, I lost count, we are still not really able to have a centralized platform to share this information. And I think this is a very nice chance for improvement. I mean, a lot of stuff has improved if you compare to where we were standing 2 years before, but still right now, I think there's a lot of room for improvement to get the data quicker, to understand better the types of variances, to respond better in terms of need for vaccines. So this is not something that is a surprise anymore, right? And I sometimes wonder a little bit that the investment we do in this field, the digital investments compared to the losses we have in terms of loss of productivity in the country. But yeah, I don't want to be so negative. Yeah, I mean, but let's say there's a lot of room for improvement, and I think that we should not be surprised anymore by COVID not going away so quickly. And I think the gathering of the data, the speed of the information, distribution of this information, And doing this in a centralized manner would be a great benefit to everyone.
Yeah. Maybe David, as you're an expert on processing, collecting, and working with data, what's the problem behind this? Is it more like a structural problem where the data is collected and how it's processed, or do we see like more of a technical challenge here, or do we already have the technical solutions to improve the situation, and some just like government or whoever else is blocking it, or what's your point of view on that?
I think, so if we start from the premise of the question, really, is where do we want to be, is rather the first question we need to ask ourselves. What is the ideal state for the data network of healthcare data in Europe? Do we want, a free-for-all market, or something which is rather extremely controlled, or do we want to be enabled by technology, which is quite complex and potentially fragmented, or do we want to choose a specific technology and lock us in? It's the target picture, I think, is unclear. There is some technical solution, definitely. There is quite a lot of research into the federated analysis type of work, where we do not move the data, and the algorithm go that preserve privacy, because the algorithm, the code is seeing the data, but the users are not. It requires quite a lot of investment. It requires quite a lot of also, let's say, footwork or dialogue and teaching about this particular type of technology. You are facing, in fact, in front of you, users, or if you want, the guardian of those healthcare data, which do not understand those technology and do not have, in fact, the funding to implement this type of platform on their side. And after that, you have I call that internally, I call that the urban legend. So people think they are not allowed to share data, or they think that some data are more special than others. And so there is a lot of, if you want, education to do also. That's a component of the problem. Gathering the data is not a single phone call and basically signing a contract saying, okay, could we get the data? Here's what we'll do with the data. No, it's much more than that. It's enabling the healthcare partner, in our case, to evolve, first of all, to make them more digital, to move the needle, in fact, of their internal database where they gather the data. If you're lucky, they have a central database, to something which is enable for you to collect the data and at speed, in fact. So that the trick is that you don't want to receive CSV file by email or FTP on a monthly basis. You want to have something a bit more evolved than that. And that requires quite a lot of investment. And the network, as Abel said, the network is fragmented. The hospitals are in very different stage of maturity on the digital thinking. Some say it will never happen with me. It's like, we don't share any data. And some others are like fairly open to a dialogue, but require investment. And that's a tricky thing to overcome.
Abel, when we think about and talk about these data, we also need to think about who owns this data, who has the data ownership. And the question is, who uses the data? And especially when we talk about business cases, the question is, what does that mean for future business cases in that area, dealing with such critical and personal data, maybe like we never did before? Is there any implication on that you see? And challenge for the future?
It's a very perspective question. I will answer firstly with a global perspective, and then we can double click in the European perspective a little bit more, which I think is a good source for hope. Firstly, the global convention that researchers and practitioners use is that the patient and the physician, so that the patient and the doctor, the clinician, they are accountable for first use of the data. So the first thing that you do is you as a patient or your caregiver gives consent. And this is a very important word in the US because there's a lot of lawyers trying to find if you made a mistake there. So the first thing is that you have to give signed consent and authorization for anything that goes beyond the first use of data. If your data is going to be used for diagnosis of your disease, that is the first use of the data. Once you have your first use, in the United States and especially in China, the data becomes a public good. And it becomes something that can be usable, and that people that have the toolkits and the talent like Alex, or people that have the scientific hypothesis and the medical hypothesis like David, then they can use the secondary data provided by an organization, hopefully that cleans it up, like Sensyne data, and then it becomes a public good, and it really advances the cause of science, of medicine, and public health. That is what the let's say the convention between scientists and doctors and patient representatives. There are two interpretations that are not like this, and then I will talk about Europe. Some governments believe that the common good is served even at the point of first collection. So that, for example, if you had contact with somebody who is infected of a virus, that is important public health information, and it should be made available immediately, regardless of whether there is a patient in the middle or confidentiality in the middle. That is very delicate. That is very delicate from a European perspective, because that is the first generator of the data. I mean, what I'm doing with my coughing and so on, it's my responsibility in some constitutions. In other parts, this is a matter of public health concern, and therefore a public good. I think that people like Alex and David are primarily worried about how we use information, first use or second use, for innovation purposes, not so much for public health. I think Alex just made a very compelling argument that for public health, the COVID pandemic has already shown the way from a data science perspective. We invented a vaccine, the world invented a vaccine in 8 months. Data was shared in 48 hours. The DNA, the pathway of the virus itself was shared by the original discoverers in hours. And people like David and many of his colleagues were working on clinical applications within weeks. So from a data science perspective, we already have seen and shown success. From an innovation perspective, it's slightly different, because from an innovation perspective, innovators working in the large pharmaceuticals or the small biotechnologies continue to have to pay very expensively for accessing good quality data so that they can innovate. The world thinks very differently about using data in a crisis versus using data in steady state. And I don't think that the regulators, the patient representatives, and many individuals, as we have seen in the reaction to the COVID vaccination, I don't think that many people have realized that in the field of medicine, innovation and privacy are sometimes opposite ends of an ethical choice. It's a very difficult conversation. I think that for me, the best thing that has happened in the last year and a half is that people like David, specifically on the call, and people like Alex, specifically himself and his team, both of them have shown that if you give them sufficient resources, they can change the world with data science applied to medical requirements. And that to me is the most important thing that I will stay with the pandemic for a very long time. If you look at the publications, the pipeline of publications, the scientific papers, the clinical research protocols that are supported by data science today versus 3 years ago, It's a step change in performance by the scientific and medical community. With that, I will stop because I know that I made a couple of statements that I'd like my colleagues to challenge.
Yeah,
I mean, maybe,
Alex,
as Abel already mentioned, we have a couple of like healthcare relevant data that we have to share from a legal perspective. Like if I'm infected with COVID-19, it's crucial that like my data is processed. But we do also have like a lot of data I don't have to share, like a lot of information that is like very private, very personal. We already talked about a couple of like more lifestyle gadgets today, like smartwatches or like smart rings and stuff like that. So we would be able to share a lot of information to corporations, but also to like more governmental organizations. So what's the main benefit for like an individual to decide, yes, I'm open to share my very private health information to a corporation or to like a governmental organization? What's in for me in the end?
You go ahead. You're mute. You're on mute.
Can you hear me? Yeah, thank you. So yeah, I was just saying that, David, I didn't want to interrupt. I think you wanted to say something before, because I think this is maybe.
It's a fantastic topic. And I mean, I've been immersed in this particular domain since a while now, of monetization of your own data. I mean, it's basically our data. It's the notion that you raised, Daniel, was that people feel it's personal data and they associate it into their mind to the other concept is it's mine and I own it. And it's, if you want, something I can monetize. People are not allowed. So if you make money out of it, I want to have somewhere to share. And I think the root cause of this feeling is because the data that you mentioned, for example, Fitbits or the smart rings or your Apple Watch mostly, or your telephone right away, basically counting your steps, those data are used for basically marketing purposes. So the data are packaged, anonymized, aggregated, and sold basically to Facebook, Google, etc., for doing advertisement back to you, relevant advertisements. And you all know the topic that you're browsing on the internet, you're searching on Google for a particular reference or a tutorial or something that you want to know more about this particular merchandise. You're sure that it will be recommended to you into your feed on Amazon in the next days. So that's what data are used. And health data, what you call health data, basically the number of steps you're taking, etc., the different way of life, is not used for health, roughly. It's used for marketing, mostly. If it's within the context of a clinical trial, so people are, let's say us, all of us are, if you want, patient, those data would be used within the context of a clinical trial to demonstrate, to do a clinical study or to do a scientific study. I don't think people would be interested in getting a royalty on the use of the data. They would be fine because it would be for the purpose of advancing science, diabetes reduction, obesity research, etc. And that would be fine. It's within a specific type of use. And I was recently reading about, there's a recent paper from Baylor College and Harvard and a bunch of big thinkers on the use of non-fungible tokens, NFT. You all heard about certainly NFT. It's basically the ability to store data on top of transactions, blockchains. And the context is behind is monetizing basically the data which are collected on a daily basis, on a chain, of time. and taking control of it. That's the context behind the blockchain system. You can control who use and for what. You have a system of smart contract which go on top of it. So that's a bit the context. So you need to nuance a bit the approach. If it's for research, and I think it's really, we could use this type of technology to track for what purpose are your data used for. And that's a thing which brings the dialogue with citizens roughly in Europe forward. People don't want to have an umbrella agreement. They're a bit afraid of that. Alex.
Yeah, maybe. Yeah, thank you. Yeah, so I also think that educating the public that you can now get reimbursed, becoming a living data product, let's say, I think this is not the right direction to go, right? So using the same incentive like the tech industry, especially the large companies like Facebook and Google do, I don't think that this is the right and ethical way to do it. On the other hand, there is still a lot of fear in our society in Europe, let's say, about the misuse of data. And I mean, I was born in East Germany, so it's not so far away also for me to remember also stories from my parents and from my grandparents, how the Stasi was spying on you. And we see also in China that maybe the free usage of data with the social scoring and everything maybe that this is still it's not gone, let's say. Yeah, it's not something that's not happening in the world. And so I think that also as a data scientist, knowing what can be done and is already done well with data, it's easy to say, well, people are just afraid and German angst and stupid, and they don't know what, that we could have had prevented the lockdown if we would have used data and technology to our all advantage. And but I think we have to understand what is the fear, where is it coming from, and we are also as technologists have to find solutions to conquer that, like David mentioned, with leveraging a blockchain, for example, to make it more obvious what your data is used for. Yeah, but I think also this has to be a large movement by, maybe the government to educate people, and I think this is always underestimated, right? So I think that we underestimate, especially when we make decisions in politics, the change management and the investment on the education that we need. Yeah. And I think if we could explain why data is used, what it's used for, if we have a thorough campaign to show the possibilities of sharing your information about healthcare, and to also show how this data then is not used by, I don't know, your private insurance company to give you a worse contract or something, or worse. So then I think, but we have to address those fears and to conquer them, and we also have to put money where our mouth is, let's say, right? And I think this is something that could definitely be improved, must be improved, and I'm really looking forward. I mean, already reading the new German contract, contract, I think it shows that there is at least a willingness to be more innovative and to embrace digital much more. But now, again, there's talking is easy. The question now is, what are the real measures that are taken? And I mean, even this really bad COVID app that we have, I'm using it, and I know a lot of people who actually are using it. I mean, so it's not that people are super rigid against that stuff. Yeah, and I think if this would have been a startup, I think it would have gone bankrupt many times already. Yeah.
It's an interesting point you make there, Alex. about the education. I think it's not only also an investment into the society through government, but it's also an investment into the startup world. So new companies need to pop up and popularize basically ethical use of data, transparency, and that need to be encouraged through basically, yes, I mean, funding, venture need to basically sponsor this type of solution appearing on the market. Otherwise, if we wait, as you said, I mean, it's a governmental startup would fail and might not develop the best product because they are not aiming for success. They are aiming to fulfill a feature list defined by governmental employee. So it's not really the purpose. So if we want to change the society, it needs to be done also with private investment and new companies.
You mentioned it already, and what the pandemic also showed us, that even if governments are very progressive in the way to address change, think about the Corona One app, so the how it is used, and also when we talk about vaccination nowadays, we will always have maybe a percentage of 20 to 30 people which don't walk this way, and we know this when we talk about innovation. We know this from the Roger curve. This is just okay. What, from your point of view, what needs to be done? So you already mentioned that there should be also some investments from the private sector. There should be some action from the government itself. So what are the measures, what you would look for, and maybe also would you like to see which going where, and what do you think, how long it might take such a change within the society? Maybe
I'll take a stab at it first. I think that as an investor, you want to see returns. So first thing is we need to see more examples, also European examples, of where data has resulted in return on for the investors. I think that I wish, and this is more than I think, I wish that the extraordinary achievements of a company like BioNTech and some of the extraordinary achievements of companies like Evotech that are applying data science to the development of better treatments and therapies become easier to tell. People that we have to change the minds at one level, at the policy making level, which both Alex and David were talking. Then we have to change attitudes and mindsets at the organization, big company level, to get people like me maybe to make more grants of money. And then we need to change the people of individual contributors of data that are going to click that button that will say, yes, I share. So the first thing at the policy level, these are not experts, but they hear many stakeholders, and they need to voice to hear that there's really good public health returns, society returns, political returns to innovation via data. I think that the stage is set for that, but media can do a better job in telling the story in simple terms. The second thing is for organizations. What I'm going to say is a little bit controversial, but I do believe that we have to empower people in marketing and sales to be courageous in launching precision therapies for individuals or small populations, so that organizations can start seeing returns from the precision that data science permits in marketing. If you think about the kind of precision that Amazon or Booking.com or eDreams achieve with their marketing, you give them access, you give them authorization, and you agree to terms. This kind of enablement allows them to give you the books, the trips, the restaurants that you're looking for. And all of these things are meaningful to advance the cause of the organization in business terms. And very few people today would opt out of their Instagram accounts or their TikTok accounts or their travel accounts because they realize that there's a lot of value in precision. At the same time, I think the rights need to be protected by applying any of the technology enablers that David said. But I think that we're talking about changing society and changing the stage in multiple speeds. And as always, I think there's a matter of timing. If you are too early, you're going to be spending too much money with not sufficient return. If you are too late, you miss the boat on innovation. My perspective is that people in the data science community should be prepared to play chess on the 3 keyboards. It's not as one solution doesn't fit all. People that are making the change in data science, like my colleagues on the call, they need to be prepared to be educators at the policy level. They have to pitch to investors at the organization level, and they need to be evangelists almost, and be creative in creating compelling business cases and use cases at the level of the patient, provider, and caregiver.
So if you would have like all the data in the world you could wish for, like if we paint like an awful scenario in the best possible way, if you would have like all the data you could wish for, what could be possible with technology in the healthcare sector? Maybe each one of you has like an example what would be possible in the future. What's the benefit for the patient in the end, or the healthcare sector itself? Because we have like a overloaded healthcare system that is not able to deal with all the incoming cases, especially during a pandemic. So maybe if each one of you has an example, what would be possible in this sector if we would have like any data we could wish for. Maybe David, you start.
Okay. It has been I think it's almost the data reciproc of the classic interview question. If I would give you $1 billion, you have unlimited funds, what would you do? In the term of, the data and where we are currently in our society and in the medical field is like it's abundant. And I think the relevance is that you still need to have funds basically to collect this data. So it's costly, okay? Especially when you talk about medical type of data. I think the limiting rate nowadays is having good ideas. It's really to come up with something concrete, basically a challenge which will be changing the deal for patient. Abel was mentioning moving toward precision medicine. There is a recent study in cancer discovery which got published a little while ago on making some tests on patient tissues before you give them basically the right treatment. It's a very basic idea. You would in fact hope it already happened, but it does not. What it's currently done is that a doctor basically look at you, say, yeah, well, you will go on chemotherapy, and another patient, you will get PD-L1 antibodies. So they will assess, they will do a few tests, but it's minimal. So moving the thing is, I would say in this space is collecting the right data, because there's so much you can collect. That's why I position myself on having the right idea. You want to answer the right question, demonstrate your point, and what data will you collect along this way to prove your point will be driven by your question. So that would be the comment I would have there.
Maybe I can jump in because I really like what you said. So I think also maybe a little bit controversial telling. I think still in medicine, a lot of people are treated like cattle, right? So basically, there's because the time and the money and also for those diagnostics and for this what we also learned today, which was a great talk, Professor Goyen, about precision medicine, because it's not possible, right? Also with our public health system, as for example now in Germany, And I think we already have this, two worlds of, or two different, I don't know, societies in terms of treatment, right? Privatpatient und Kassenpatient. And I think that with technology, we have to finally the possibility to overcome that, right? So what I mean is that if you go to a holistic healer, I don't know, anyone who's in not classical medicine, but in holistic healing, Heilpraktik, they will always kind of check you as a human being and unique system, right? So like even talking about how do you feel, how is your family, did you drink enough today, did you do any sports, and they would always come from a holistic point of view and then narrow this down, and maybe you have an aching pain in your head because basically your hip is I don't know, wrongly, or your foot is too small or whatever that is, or you're wearing the wrong shoes, whatever. But on the other hand, if it comes to chemistry, and if it comes to, well, really giving you hard medicine, or if you have an injury or something, then still the classical medicine is still what you want to use. And I think now with AI and with data, we have the possibility to bring this together, to really do a pre-diagnostic or holistic individual treatment, and even before the real damage is done, right? And I really would love to see this coming. And I think that some companies we will see some companies like the Google of medicine or so arise. I'm very, very sure in the next 10 to 20 years, because the box of Pandora is already popped, right? I mean, now we have seen that even in Germany, a company like BioNTech can, I don't know, grow as much to be responsible for, what was it, like 20%, 25% of the German GDP growth. So it's already happening, and it's also happening in Germany, not just in Silicon Valley or in China. And I'm really excited. That's why I'm also personally going more into the topic, because I think there's a lot of movement gonna happen, and a lot of good gonna happen, and I'm very happy to be part of that.
I think
so maybe Abel, you also have an example.
I will offer a variation of the theme that my colleagues expressed. I think that if I had access, let's say that we could access and process unlimited data, I wish that every one of us, not only in the West where we have great medical access, but also especially in countries like Brazil, Malaysia, Nigeria, South Africa, Mexico, that have overstretched or insufficient healthcare systems, China. I wish that we could have a digital twin with a few biomarkers that could really, and again, we do not need 500 biomarkers. We need 40 or 30 that work really well, that give the physician in the point of delivery a better perspective of who we are. The blood samples are the example. I mean, for many decades, we have used a blood analysis to prepare ourselves for surgery, to prepare ourselves for any kind of therapy. The first thing they do is they take your blood and then they look at indicators that are directionally correct, but they're not precise. Imagine something 60 or 70 decades, 60 or 70 years in the future that could be precision biomarkers to give a physician better information. I think those biomarkers need to be combined by increasingly better machine learning agents to give a better recommendation at the point of care for the many people that don't have a doctor close by. That could be transformational for the healthcare of the world, not for people like ourselves who have access to Wi-Fi and broadband, but for people that have to walk for water, that have no access to other things, but maybe today they have access to a mobile phone. So my wish would be to create a digital twin that could really be used by innovators everywhere in the world with permissions and access rights to give a little bit of a better life to those people that are very far away from quality healthcare.
Okay, so there are exciting times ahead, and I'm really looking forward to it. And I think today we had a pretty good overview on what is already possible, what might be possible. There are a lot of more areas we haven't talked about today in healthcare, but I think we will continue this conversation, and also like we will do more of those fireside chats and insights on healthcare and how it's developing and